Hello, my name is Carly Prine. The purpose of this presentation is to provide an overview of the IBM Micromedics Drug Reference Application. Micromedics is available via smartphone application on Apple, Android, and Windows 8 devices. The Micromedics application is a drug reference application used to provide comprehensive drug information on the go. The application provides information on adult and pediatric dosing, common and serious adverse effects, drug interaction, administration information, IV compatibility, trade names, generic names, contradictions, monitoring, and much more. The IBM Micromedics application costs $2.99 per year and can be accessed anywhere and anytime via your smartphone or device. Certain hospitals or institutions already have subscriptions through Micromedics, and the application for their employees can be downloaded free of charge. Micromedics is useful in professional nursing because it is a useful tool for nurses when researching medications they are providing to their patients. If a nurse is unfamiliar with the medication, a nurse can use the application to be better informed about the medication, the side effects, how to give the medication, and monitoring of the patient while taking the medication. Additionally, the application gives clinical teaching information that the nurse can provide to the patient while taking the medication, such as side effects, precautions while taking the medication, and things to avoid. Also, the application gives important black box warnings from the FDA on serious hazards regarding certain medications. The navigation of the Micromedics application is easy and user-friendly. The operator can navigate through the application by just clicking the drug information. Upon opening the application, a list of drugs appear in alphabetical order. The user can choose to search the drugs via alphabetical list, by the drug class, or by searching the name in the search box at the top. An example of how it looks is shown in Figure 1. By clicking the name of the drug, it brings the user to a drop-down list of the information provided, including dosings and indications, contradictions, warnings, drug interactions, adverse effects, drug name information, mechanisms of action, pharmacokinetics, monitoring, how supplied, toxicology, and clinical teachings. Clicking the area of information needed, additional drop-down list appears where the user can refine the search of the information even more. For example, look at the picture in Figure 2 within the slide. If the user clicks dosings and indication, a list appears that says adult dosing, pediatric dosings, and dosing adjustments and indications. The user may click the desired section and a list of information appears about the desired topic. The speed of access of data within the application is quick and results appear instantaneously. Minimal work is needed from the user to access and obtain information. Results from the application are clear and give the user exactly the information intended. The readability of the application can be difficult because the text is small and there is no pictures or coloring to enhance the information, making it difficult for some users to read. However, there are bullet points and bolding that helps enhance some of the information. Additionally, the content of the information displayed can be difficult to understand without medical and pharmaceutical knowledge and may require some explanation. Since there is no private information stored on the application, there is not a concern regarding the privacy of health information. However, there is legal and ethical issues regarding the safety of information provided. Micromedics provides a disclaimer regarding the medical information provided within the application. The drug directory content is to be used by only healthcare professionals, and the information provided is to be used with other clinical data. Additionally, there is no guarantee that the information is entirely complete and that there is not unknown information regarding the medications and its health effects. The information provided should not be used as primary medical advice and should not substitute medical care. The primary medication information should be received by a patient's healthcare provider, and they must speak to the provider regarding any healthcare concerns. Micromedics is beneficial for nursing because it is a resource tool for nurses when administering medications, helps provide education to patients, helps keep patients safe by decreasing medication errors, by allowing the nurse to ensure the right medication is given for the disease at the correct dose and the correct route, and that the application is easy to operate. The limitations of the application include the information is not individualized to the patient, can be difficult to understand without adequate knowledge, and the application relies on functioning technology. Overall, the application is very useful for nurses in their practice. The hospital I work at is contracted to use this application as a source of information, and I would highly recommend for any nurse to use this application because it provides knowledge of medication and medication administration in a fast and easy way. In conclusion, Micromedics enhances the nurse's knowledge of medication and medication administration by providing the nurse with information about the drug and clinical teachings for the patient. Additionally, the application displays results immediately and is easy for the operator to use. Overall, it's beneficial because it will help the nurse provide safe care for their patients and help educate nurses and patients as medication knowledge grows.